good evening, and welcome to another episode of Paw Talk, which is our free monthly educational webinar. I'm Dwight with Sentinella Feed and your host for tonight. And as usual, we'll be keeping the presentation to about 15 to 20 minutes with a short Q&A session at the end. So feel free to type in any questions that you have in the chat box during the presentation. And if we don't have time to get to your question at the end, we will be replying to everyone's questions via email. So this month is National Pet Dental Month, so it gives me great pleasure to introduce Andy Jacusko, who is the owner and pet hygienist of Breath Savers. And Breath Savers provides anesthesia-free dental cleaning for dogs at 11 of our Sentinella Feed locations. Breath Savers has been a partner of Sentinella Feeds for many years now, and I'm delighted to offer the floor to Andy to not only discuss the service, but to learn how to maintain proper dental health and hygiene for our furry pets. So Andy, go ahead and take it away.
Great. Thanks a lot, Dwight. Welcome, everybody. Like Dwight said, I am Andy with Breath Savers Pet Dental Care. Our company is the one that offers the free, non-anesthesia-free, teeth cleaning for dogs and cats. I work with a team of myself as well as Lisa with Chompers. And we also have a licensed veterinarian that's with us on site for each teeth cleaning dental clinic that we offer. Without further ado, let's go ahead and get started. I'll show you what the before and afters can look like when it comes to doing the teeth cleaning on your dogs. As you can see here, this is the picture on the left is the before. That's the tartar buildup. And obviously on the right-hand side is the way the teeth will look once we're done scaling the teeth and polishing. Now you can see in my hand on the right-hand side, that's a normal dental scaler that any dentist would use, including the ones at your veterinarian office. Let's go ahead and get started. We'll talk a little bit more, some facts about your pet's teeth and our cleaning process. Basically, the non-anesthesia teeth cleaning isn't the only way to get your pet's teeth clean, as both types of cleanings complement each other. And what I mean by this is that not every dog is going to be a good fit for the anesthesia-free teeth cleaning. And so what happens is we like to complement our services with an anesthesia cleaning. There are going to be things that could be happening under the gum line that we're not able to see. And that's when we would refer you to your vet to do an anesthesia cleaning. And as far as our non-anesthesia teeth cleaning process is concerned, I'm going to go through it a little bit more specific, but the cleaning process takes about 20 to 30 minutes. And our veterinarian will do a little mini exam before we start doing the teeth cleaning and getting the procedure going. As far as dogs and cats are concerned, dogs have a total of 42 teeth in their mouth. Cats have a total of 30 teeth. And believe it or not, us humans, we have 32 teeth. Basically, any puppy that you have will lose all of their baby teeth within 4 to 6 months, and the adult teeth will start growing in. Now, what you'll notice is sometimes when you have a puppy that's playing or running around in the house, you may see a tooth on the ground and so forth. But normally what happens is the dog will either swallow the tooth or it'll get left in a toy or fallen out outside while the dog is playing. Like I mentioned before, not all pets are good candidates for our services. Sometimes we have health conditions that we see, or the teeth or gums are an issue where they've got advanced periodontal disease, or there are times when we have behavior issues that could be the dog is either really active or could be mouthy. But with that being said, we are the ones that want to make that judgment call. So if you do have a dog that is a little mouthy, we can still evaluate it. And that doesn't mean that we're not able to do the cleaning. But if we're not, we don't charge you and we would refer you back to your vet. One of the other things that we like to point out is that a lot of times there are dogs that'll have staining or brown or yellow staining on the teeth themselves. That's due to thin enamel, and the enamel is like a clear coat on the teeth. It kind of equates to like the clear coat on your car. Once the car starts to oxidize, it's very hard to clean those teeth. But with that being said, the staining has no health risks involved in regards to keeping your dental health for your dog. We just like to point out that if there is any kind of issues with staining or anything like that, we let you know after we're finished with the cleaning. Some people will ask me, should they be doing brushing at home? And the correct answer is yes. At least 2 to 3 times a week would be ideal. Any kind of home health care that you can give in regards to your pet's hygiene, and teeth brushing would be one of those options. And we can go through and show you some techniques on how to do the brushing while you're at home. Okay. Now, as far as the last bullet here, just because your dog is mouthy or could bite doesn't mean we can't do the cleaning, but we'll definitely ask you some questions before we start the cleaning process. And we want to know that if your dog does have the possibility of biting. If they do, we can work with them a little bit differently to make it safe for them as well as for us. Here's the step-by-step teeth cleaning process that we offer for Sentinella. We greet each owner and the pet. While we're explaining our cleaning process, we're kind of observing the pet's body language and interaction with us, as well as any of the other dogs that may be around in the store while we're doing the initial assessment. We will ask you about your pet's medical history. And also, like I said, if your dog's ever been nippy or have they had teeth cleaning in the past? Have they had anesthesia or non-anesthesia teeth cleaning in the past? Once that's done, we'll take your dog back. We'll report what we were able to come up with from our discussion with our licensed veterinarian, who's going to do a little mini exam to make sure your pet's a good fit for our services. They're going to look into the ears. They're going to take a glance in the mouth. They're also going to listen to the heart, make sure we don't have any issues going on. And if everything looks great, then we go ahead and start the cleaning process. We will scale the teeth, and we finish with an oral rinse and a polish. Like I said before, the process takes about 20 to 30 minutes. Once we're done, excuse me, we'll go over the charting with the owner of the dog, and we will collect the payment and answer any questions you may have. And at this point, that's when we will help discuss and show you how to do oral care at home with teeth brushing and things of that nature. Another question that I get from time to time, are our tools sterilized and how does that work? We basically sterilize each scaler to the recommendation of the manufacturer, and any teeth polishing that goes on, every dog gets a brand new toothbrush, and so it's used one time and thrown away. So it's time to get to work. And here's Oscar. Excuse me. He's a 6-year-old, 80-pound mix that we were working on. And as you can tell, he's actually awake, believe it or not, and he's doing fine with the cleaning process. Here's a little picture of his teeth and the tartar that he has built up on the teeth. And I want you to notice the black that you see on the gums. That black is pigment. There's nothing wrong with his gums. I've had people come up and ask me, what's wrong with my dog's gums, because they're not pink like the majority of the gums are. There's no problems or issues as far as that's concerned. It's just the normal gum tissue. And you can tell that actually the amount of tartar that Oscar has is about moderate tartar and mild to moderate gingivitis. If you look right at the base of where the tooth, or the tartar, I'm sorry, is resting on the gum line, you'll see a little bead red once we remove that tartar, and that's where the recession was starting to happen. And we want to remove that tartar and bacteria before the tartar starts to create some recession, because once the recession starts, we will also have problems with loose teeth. And once a tooth becomes loose, it'll never tighten up. And once the recession starts, the recession will continue until we remove the tartar, and the gums will never rejuvenate any new tissue, but the gums will become healthy once we get that bacteria off the gum line. So we're working with Oscar cleaning all 42 teeth with the scaler. Some people will ask me, are you guys able to clean on the inside of the mouth? Yes, we can clean the linguals without any problems or issues. We have a few different techniques on how to do that to make the teeth cleaning process safe for your dog as well as for us. Excuse me, you can see how well Oscar's doing. He's actually awake. Some people think that that's a still shot and that he was really put under some kind of mild sedative or something like that. Just so you know, we don't offer any type of mild sedative or any type of medication. We don't know your dog's history. We don't know what kind of reaction your dog could have. Some people like to give CBD. Some people may get a prescription from their veterinarian to get some ACE or get something like that. We say that if that's an option for you, I would say go ahead and utilize that. And we can make the teeth cleaning process as safe and as less stressful for your animal if there's any need in regards to using the pharmaceutical options with some medication. While we were getting close to being done here, you could see that Oscar is still relaxed. And at one point, I thought I was hearing him snore, but he was doing really well with the cleaning. We were close to being done with the cleaning at this point. And then it's time for us to polish. So we start polishing those teeth, and we have the polishing paste that the veterinarians use, and we use all the same products that the veterinarian would use. But with that being said, I also want people to know that we're not doing blood work, we're not taking x-rays of the gums, we're not doing anything beyond what our naked eye can see in regards to the condition of the tartar and the amount of gingivitis that we have going on in the mouth, and as well as staining. And this is where we say our services complement the anesthesia cleanings because the two complement each other. And our goal is to lessen the frequency throughout the lifespan of your animal to not always having to go under for an anesthesia cleaning. Also, again, medical issues that could arise. Maybe your dog has a heart murmur or other things going on where an anesthesia cleaning is not an option. Well, at this point, then let's just try the non-anesthesia teeth cleaning. And at times we may see a dog that does have a heart murmur, and we would recommend before we do the cleaning, you should speak with your veterinarian and possibly get an order of antibiotics to give before we do the cleaning and reschedule you for that cleaning. So we're continuing to polish Oscar's teeth here. And now you can see what they look like. And if you look at that canine on the upper right, you can see that beaded red portion of the tooth, I'm sorry, of the gums. And that's where that tartar was irritating the gum line. And so we were able to get rid of all that tartar, and he was free to go. Now, this is the before and after of a different animal, not Oscar, that we did the teeth cleaning on. But you can see the tartar buildup as well as the black pigment that we had in that mouth. So what are we looking for while we're doing the cleaning? We continue to evaluate your dog's behavior, and we're keeping the cleaning process as safe as possible for your dog as well as for Lisa and myself. We're also going to continue to examine the condition of the mouth in case we see or find any kind of issues with the gums, loose teeth, broken teeth. We're also looking for any kind of abnormal tissues in the mouth. We have seen in the past where we have found cancer and other types of gum issues. We're also have been able to uncover teeth that have been broken. Sometimes the dogs will chew on something more aggressive than their teeth can handle. It could be as something as small as like a bone or one of the bully sticks, or it could be something as aggressive as the antlers. We have seen dogs that have actually chipped and damaged their teeth by chewing on the antlers. So if you have a dog that's an aggressive chewer, we recommend to go with something a little bit softer that's going to be a little bit more forgiving. Also, we're keeping an eye on the color of the tongue and the gum tissue. We want to make sure that your pet continues to breathe and that we're not giving them too much distress to where they're not breathing. And so we're keeping an eye on the color. We're also working with your dog to make it a safe cleaning process by repositioning at times and again, just kind of reevaluating while we're continuing to do the teeth cleaning and removing the tartar. Once we're done with the teeth cleaning, we do communicate with the vet. And if we see any kind of issues that we need to have her or him evaluate, we are able to do so. And when we are finished with the teeth cleaning, we also have the veterinarian help us with the charting, which is what we go over with you at the end of our teeth cleaning process. Excuse me, here's a before and after with another dog that we worked on. You can, again, see some of the black pigment in the gum line. Again, that's totally normal and no problems or issues. Now we're going to go ahead and show you about small dogs. Oscar was a big 80-pound dog. We also are able to obviously do the smaller dogs, and we use what we call the wrap method. And basically what we do is we've wrapped Sandy up here in a towel, kind of like a swaddling position. And Sandy has been a client of mine for, I believe, about 4 to 5 years, and comes to see me about every 6 months. With the smaller dogs, we like to see them about every 6 to 9 months. With the bigger dogs, we like to see them 9 to 12 months. And we like to just, it gives us a chance to kind of reevaluate the mouth as well as keeping that tartar down. And again, if by chance we come across anything that we feel uncomfortable, we err on the side of caution. We refer you to your vet to go do an anesthesia cleaning. and we don't charge you anything. And then we say, once you're done with that cleaning, come back and see us in about 6 months. And then we can get back into this program of trying the non-anesthesia teeth cleaning. If we by chance do uncover anything that we're concerned about, again, we would just refer you back to your veterinarian. So a lot of my clients will do 3 or 4 non-anesthesia teeth cleanings, and then they'll do an anesthesia teeth cleaning. We also recommend that if your dog ever needs to go under anesthesia for maybe to remove a growth or something like that, at that point, you might as well do the teeth cleaning while they're under anesthesia. And we do like to stress that if you are going to do an anesthesia cleaning, make sure that the veterinarian is able to offer the x-rays. That's going to give you the best complete picture, if you will, of what's going on under the gum line. Here's a before and after as well. This obviously it's not Sandy, but you can see the before and after on this dog. And to be honest with you, I don't remember the name, but we just did this one at the Sentinella Feed in Pasadena, and was a very cooperative dog. And I told the owners we were going to add them into our webinar, and she was so tickled. And so that's a before and after right there. Like I said, once we're done with the teeth cleaning process, we let the owner know how it went and any kind of concerns that we observed that we need to report back. We go over the charting process, and we also let the owner know if we want to see your pet back in 3 to 6, 9, or 12 months. We also like to educate the owner again on how to brush at home, and any kind of other aftercare that may go on. One of the other things that we do like to recommend is different treats. Whimsies is one of the treats that Sentinella Feed and Pet Supply do sell. And the great thing about the Whimsies for us is they have an all-natural dental stick, which is full of ingredients that we can pronounce, and also doesn't have all these extra calories like some of the other treats that are out there. And the Whimsies history basically started in 2013 in the Netherlands, and they've only been accessible to us here in the last few years, I believe about 5 to 6 years, if I'm not mistaken. So with that being said, we are also offering a 20% discount for our teeth cleaning services until the end of March 2024. What that means is the normal cost for the teeth cleaning is $175. And that means that you would go into your local Sentinella Feed and Pet Supply store, leave a $25 deposit, and then it's normally $150 once we're done with the teeth cleaning. But with this special offer, due to February being Dental Appreciation Month, we're going to give you $35 off that $175. So it's only going to cost you $140. So with that being said, again, you go into your local Sentinella Feed and Pet Supply store, leave a $25 deposit, and you don't have to do that deposit at the store we're going to offering the dental clinic. You can go to any of the Sentinella Feed and Pet Supply stores. But after the $25 deposit has been made, then you can call the store or get on our schedule by making your deposit. Once my team and I show up, we get a printout of what we've got going on for the day. When we're done with the teeth cleaning, we will again go over the charting and collect the payment. That's about it with my presentation. If anybody has any questions, feel free to give me a call, or I believe we're able to answer some questions here. And this is my email address.
All right. Great. Thanks a lot, Andy. That was very informative. And we do have some questions here. So let's see. First question is, how can I tell if my dog has gum issues?
Well, that's a very challenging question to answer. Excuse me. Even at times, I will have people that call me and say, "How do I know if my dog's going to be a good candidate, or what are the conditions that that my dog's gums are in?" And all I can tell you is this: you set up the appointment and you let us do that evaluation, and then we can make that decision. Now, I can tell you that you're not going to be able to tell if there's anything specific going on with your dog's gums, but if you start to see your dog maybe not chewing or eating as quickly as they used to, maybe not playing with the toys that they used to, there could be some swelling, there could be some irritation, also some discomfort and smell coming from the mouth. that usually tells us that there is something going on in your dog's mouth. And with that being said, I would definitely recommend to go see your veterinarian because it could be beyond our scope of work. If you happen to bring your dog to us and we see anything that's going on, we'll definitely let you know and refer you back to your vet.
That's good. All right, next question is, are gloves used for the teeth cleanings?
Yes, gloves are definitely used as well as eye protection. With Oscar, he's my own personal dog. And with the other two dogs, after I was finished with the cleaning, the gloves, I took the gloves off and I was able to open up the mouth to get better pictures.
Right. We have a question about cats. Do you do cats?
Correct. So we used to do cats. In fact, some of my clients, for Sentinella Feed and Pet Supply, we did do cats in the past. Due to safety concerns and issues in some of the areas that we work in, we are not able to feel comfortable and secure to do the teeth cleaning on the cats. So we have just made it basically no longer offering any services for cleaning the cat's teeth. But with that being said, you can email me, and I do have a referral with a company that's in LA, and Gina is the hygienist that I've known for about 9-10 years now, and they do offer the non-anesthesia teeth cleaning for the cats.
Okay, so we have another question here with regards to cats. You've just given us that info on cats, but I'll just read it anyway. My vet is advising against anesthesia-free teeth cleanings because it will supposedly damage enamel, etc. My cat has beginnings of tartar buildup at only 9 months, and we use Oratine. Would he be a candidate for the anesthesia-free cleaning?
So a couple different things with that statement. So, excuse me, first of all, I'm not a veterinarian. So with that being said, I'm not here to argue or to preach that my services are going to be any better or any less than what your veterinarian is able to offer you. I can tell you that I work under a licensed veterinarian who has the experience of observing us doing the teeth cleaning. With that being said, being the fact that the cat is so young, that tells me that the enamel is probably thin, and that means that the tartar buildup is going to continue to build, and it will build fairly frequently. Again, from a behavior standpoint and from a safety standpoint, we have just decided to no longer offer the non-anesthesia teeth cleaning. When your veterinarian is mentioning, though, that we're going to do damage to the enamel, anybody that's going to be doing teeth cleaning on your dog's teeth is going to touch their teeth with a scaler. And we don't damage the teeth, and we do the polish at the end, just like any other responsible veterinarian or hygienist would do in order to do the teeth cleaning.
All right. Let's see. I think you mentioned you might offer some tips for brushing. Would love any help since my dog just loves to try to bite the toothbrush. I've also tried with my finger, but I don't think I can anywhere. Uh, excuse me. Also, is bad dog breath a sign of stomach discomfort, and can it get worse if you move them from kibble to real meat?
So the first portion about the dog biting on the toothbrush, that's normal. I do have a lot of clients that tell me that they try to brush at home and the dog's trying to brush on the bite down on the toothbrush and so forth. And that's why if you have a dog like that, I don't recommend getting those little green capsules that go over the tip of your fingers because you don't want the dog to accidentally bite your finger or the fingertip. The teeth brushing with the dog trying to chew and bite is normal. Just try to do the best job that you can in order to get in there and brush those teeth as well as you can. As far as showing you techniques, I can't do that here, but if you ever come to see us, we can show you a few techniques. We've got a couple of systems on how to hold as well as how to access the teeth to get those polished.
Great. And then what about the what would you say to the kibble versus grilled meat or like a raw food diet or something like that?
So I do find that a lot of people want to know what kind of treats to give, bones and so forth. I can tell you that it's very subjective. I do not know or have the knowledge of what what's going to be a good diet for your dog, but I do know that a lot of the stuff that's out there that is good for your dog's dental needs is not very good for the digestive system. So with that being said, I say pick a diet that's going to be the best for your dog. And then let us work on doing the teeth cleaning, and you're doing the brushing at home. I As soon as somebody asks me about what's a good diet, I refer them to the sales reps for Centinela Feed and Pet Supply, because they do an excellent job in training all of their reps on what's going to be a good diet. I do hear at times people mention, kibble, and that's a great thing to help keep the dog's teeth cleaned. Well, actually, to be honest with you, that doesn't happen. If you ever see a dog that eats kibble very quickly, what will happen is they'll throw it up, and you'll see that the kibble is still in the same shape as the kibble. So the dogs do not chew up the kibble to help clean their teeth. They're just eating, and they're eating as quickly as they can. So don't rely on chewing the dog eating kibble in order to keep the teeth cleaned. Now, as far as diet, between raw and kibble, again, I would refer you back to the sales reps, because the customer service reps know exactly what's going on in regards to that. I do hear at times that, the dogs that are on raw diets are going to have better teeth than dogs that are on kibble. I really can't answer that question, correctly. I just know that whatever is a good diet for your dog is what we would recommend.
Great. All right. So that's all the time that we have for tonight. Thanks again, Andy, for your time and educating our guests. And you can take advantage of the Whimsy's Dental Treat promotion either online at sentinelafeed.com or in any of our retail locations. Be sure to keep an eye out in your email inbox or on our social media pages for next month's invitation to Paw Talk. A link for a short survey will be sent to you, where upon completion, you will receive a discount code for 20% off on all dental products, as well as your first dental anesthesia-free dental cleaning. For more information on how you can reserve your spot for a dental cleaning, you can visit our website, sentinelafeed.com. Thanks again, Andy, and thanks again, everyone, for attending, and we'll see everyone next month. Take care.